the process for the amendment of the IHR 2005 and call on the process to respect the spirit and objective of Article 55.2 of the IHR. And there we believe that it's important to move forward with the defining clear and sustainable commitments for developing countries in particular. With regard to the pandemic agreement process, we wish to underscore at this WHA that we will not be supporting it if it implies establishing standards that go beyond our national constitution, which define us as a clear, free and sovereign nation. We thank delegations for their commitment, capacity and willingness to work together throughout these negotiation processes, which we know have been very complex and have involved lengthy hours of work. Thank you.
Thank you, Malaysia, to be followed by Iraq.
Honorable Chair, Your Excellency, Director General of WHO, Excellencies, distinguished delegates, ladies and gentlemen. On behalf of the Malaysian delegation, it is my distinct honor to extend our warmest greeting of Assalamu alaikum, peace and blessing be upon the 77th World Health Assembly. Malaysia offers our sincerest appreciation to the World Health Organization and the Director General for the comprehensive report and commendable works. It is abundantly clear that our joint effort assumes a crucial role in shaping the future global health ecosystem. Reflecting on the 14th General Program of Work, GPW14, Malaysia is optimistic that it will serve as a key instrument in guiding member states and other health players. The forthcoming roadmap will also empower WHO to operate effectively across all organizational levels. Together, we can make significant strides in improving health outcomes to achieve the noble sustainable development goals. The theme of all for health, health for all, is truly a moral and social imperative that resonates deeply with Malaysia's ongoing transformation in healthcare financing and service delivery. Our vision is centered around a seamlessly integrated person-centric care with a strong emphasis on prevention and primary health care. We are transforming the way care is provided by driving digital health innovation to bring services closer to home. This is supported by the equity-enhancing sustainable health financing reforms. Distinguished delegates, the COVID-19 pandemic stands as one of history's greatest moral failures, as the right to health was significantly undermined by the inherent inequity in healthcare distribution. Be that as it may, global collaboration on an unprecedented scale had not only produced life-saving vaccines that enable our return to normalcy, it had also presented us with an opportunity to forge a better way forward and building it stronger. The ongoing negotiation by the INB and Working Group on IHR amendments underscore the undeniable need for collective actions and mutual support, which is in line with Malaysia's belief in promoting equity, solidarity, and transparency as the fundamental principle and building block of a stronger and more resilient global health landscape. And with that, let us harness our collective insights to work towards our shared goal together. I thank you.
Thank you, Malaysia. Iraq, you have the floor, to be followed by Latvia.
In the name of God, the most merciful, the most compassionate, Mr. President, Mr. Director General, ladies and gentlemen, it is very well known what is going on currently in Gaza under the Israeli aggression, which has led to the loss of thousands of innocent lives, especially children, women, and elderly. And this aggression has led to disabling the health infrastructure in Gaza, threatening the lives of many thousands, hundreds of thousands, and therefore we ask from this rostrum to impose a ceasefire and to provide humanitarian aid to Gaza. And based on the instructions of the Prime Minister of Iraq, we hosted a first wave of the wounded and sick from Palestine, and we reaffirm our willingness to host subsequent waves of those who need help. The Iraqi government program has put health as one of its most important priorities in providing the health necessities and equipping our facilities with the latest technology and equipment. In addition to the early detection of chronic diseases and cancers such as breast cancer, and providing the necessary therapies all over the territories of the country. Mental health has also acquired a great importance in our program to rehabilitate those in our society in cooperation with the UNODC and the WHO. We were able, through our cooperation with WHO, to drive down the numbers of maternal fatalities, and child and maternal health was also improved, and we were able to maintain our position with regard to the defeat of polio and being polio-free, and especially in cooperation with the EMRO office. We are collaborating with the WHO to make our health system digitalized, and we reaffirm the importance of cooperation with WHO and provide the program under Health for All and Health for All and All for Health. Thank you very much.
Thank you. Latvia, you have the floor, to be followed by Gabon.
Dear Director General, dear Excellencies, firstly, I align with the statement of the European Union, and I thank you, Director General, for your report. This is my first World Health Assembly as the Minister of Health of my country, and I'm glad to learn more about the organization's challenges and success stories. Excellencies, we live in an increasingly unstable world. This sounds like a cliché, but unfortunately it's true. We witness human suffering across the globe every day in Ukraine, Gaza, Sudan, Ethiopia, Congo, Yemen, and elsewhere. Let's not forget that each conflict has a negative effect on public health and health resilience, also in neighboring territories and regions. In this context, I especially wish to express Latvia's heartfelt support to the people of Ukraine. While the Russian Federation is a member state of the WHO, it continues immoral attacks on Ukrainian health system. It has already destroyed more than 700 hospitals and other health facilities. More than 200 healthcare workers have been injured or killed. We therefore, Latvia, condemn Russia's war of aggression against Ukraine in the strongest possible term. We call upon the WHO to continue and expand its humanitarian activities in Ukraine in accordance with Resolution WHA 7511. Moreover, while condemning this by strongest possible terms Hamas for its brutal attack against Israeli civilians, Latvia is deeply concerned about civilians in Gaza, about the catastrophic humanitarian situation, and calls for a rapid and hindered humanitarian access into and throughout Gaza. Excellencies, I note we have a rich agenda at this year's Assembly. I sincerely welcome WHO substantial work, including about the very topical issue of climate change and health. However, I believe that this time the two highlights are the adoption of the GPW and our collective work on the pandemic agreement. While we welcome the adoption of the GPW, we also call upon the organization